We have just seen the importance of the clinical in researching new risk adjustment diagnoses. What about the paraclinical? Paraclinical tests are good sources of risk adjustment diagnoses. But most often, we need to read the entire report to see where the diagnosis is written. That is why it is essential to not limit yourself to the impression part of an imaging test report. In most cases, the MRA diagnoses are documented in the finding part. Let's read a CT abdomen as an example. Findings. The liver, pancreas, spleen, and adrenal glands appear within normal limits. The kidneys appear within normal limits other than a less than 1 cm simple right renal cyst, and a few millimeters left renal cyst. The abdominal aorta is normal in size, showing atherosclerotic calcification. There is no bowel distension. Impression. No abdominal mass or adenopathy is identified. There are very small bilateral renal cyst. Suppose the healthcare provider just read the impression. In that case, he will not document the MRA diagnosis, the atherosclerosis of abdominal aorta, missing the opportunity to increase risk adjustment factor score and the reimbursement for his medical practice. Since the aorta starts from the thorax to go down to the abdomen, it is a good practice to ask for the aorta description when ordering an imaging test of the thoracic or abdominal body part. Sometimes, the imaging test report comes with no mention of the aorta, like we can see in that chest X-ray. Findings. There are chronic parenchymal and pleural changes in the left lung fields. The right lung fields otherwise appear clear with no airspace opacities, infiltrates, pleural effusions. No suspicious pulmonary nodules are seen. The peripheral pulmonary vascularity, heart size, and mediastinum appear unremarkable. Impression. No acute cardiopulmonary disease is seen at this time. As we see, no mention of the aorta at all. It is preferable to know what is going at the aorta. It would be better if the report described the aorta the following way: aorta is normal, or aorta is unremarkable, as seen in that next CT chest example. Findings. The heart is normal in size. No mediastinal adenopathy or hilar mass is identified. The thoracic aorta is normal. There is pleural effusion. There is no axillary adenopathy. No lung nodule, mass, or infiltrate is identified. Impression. No abdominal lung or adenopathy is identified.